the 18th and 19th century in North America, in the United States. So these are things that can happen. And you may not be able to control the death rate from a brand new virus, but dying from bacterial infections that we've been exposed to before, that we've known about for hundreds of years, just because we have been knocked off the grid, that's unacceptable.
Yes.
Because we have antibiotics. We have the possibility of getting antibiotics.
Store them.
That's right.
Preppers.
Okay, so you
Be prepared.
So you're the medic. You're the medic. So accumulating over-the-counter drugs, okay, that's easy, but prescription medicines, not so. Even if you had a sympathetic doctor, it would be difficult for you to be able to get more than just a small amount of medication, certainly not enough to be the caregiver for a survival community, off the grid in times of trouble.
Can I give the little spiel about how you can get a little extra from your prescriptions?
Oh, okay, yeah.
So you have prescriptions, and there is a time when you can go get them refilled that your pharmacy will allow you to then have it billed to your insurance company. That is not always known. Ask your pharmacist, when can I come back? Because it is not on the 28th or 30th day. It is before then. So if it's at the 21st day, you go get the new prescription. Take those 7 that you've just saved, because now you've got a whole new bottle. Go ahead and take those 7, because those are going to be the oldest. Then after you've taken those 7, then you break open the new bottle. When you have taken now 2 weeks of that new bottle, because you already had a week from the previous bottle, that's another 21 days. You can go get the 3rd bottle. But when you get the 3rd bottle, you will have only taken 14 of that 2nd bottle. So we're going to call it 28 days. So you've got another 14 before you even break into the 3rd bottle. If you can imagine doing that every 21 days, because that's when your insurance allows you to go back and get a refill, you're going to start accumulating in the future bottles that you haven't even opened up yet.
Not only includes antibiotics, but includes blood pressure medicine, just about any other
cholesterol medicine,
just about any other
diabetes,
kind of
metformin, sure, absolutely.
Right. So I want to just say that there's going to be a larger incidence of infection when people have to fend for themselves. I think that this is pretty clear that it's been a while since you've had to blaze a trail through the jungle.
Are you waving around a blade?
I'm waving around a machete. Or had to
that one's really sharp.
Chop wood for fuel. Kidding.
I'm gonna have to show them how to stop hemorrhaging.
Okay, yes, that's
right. For another show. Soon.
So for city folk, or suburban folk who don't do this on a daily basis, maybe you do that out there on a daily basis, but for folks that don't do that, well, especially if you do it without hand protection, you're going to wind up having injuries that you as medic are going to have to deal with. And those injuries can indeed become infected. I should mention, I guess, what a wound infection looks like. A wound infection usually takes the form of redness, heat, and swelling. So those are the things that you'll see. It takes a day or two really to show up, which is why some doctors will wait a couple of days for an open wound to manifest whether it's going to turn out to have an infection or not. And they won't close the wound right away. They do what they call delayed closure. If there's no redness or swelling after a couple of days, then they'll close the wound. That is a delayed closure. We've talked about that on previous shows.
I just want to mention a couple other ways you can get injured easily. Kitchen injuries. I mean, and that's today. So when we do talk about the bleeding, how to stop bleeding, we show you guys all of the techniques for that. That's going to be used today, or even car accidents you come upon. But in addition to chopping wood, I think of the daily meals that are going to have to be made. All the injuries that are going to happen between burns and like and then butchering animals. Think about that. And just so many things that we're going to be doing outside that I pretty much think I'll cut myself every day. I do that in the kitchen anyway by accident in modern times.
That's right. So redness, swelling, as the swelling gets worse, the skin starts looking shiny, it looks red, it'll be warm to the touch. If you have an injury on your arm, on one arm, let's say, if you feel the other arm, you know that the red area on the near the injury or in the injury is going to be significantly warmer. These are things that you're going to see happen. And as an infection gets worse, this kind of infection, which is often called cellulitis, a soft tissue infection, gets worse, it often travels towards the torso. And that's why it's a good idea to take a felt tip pen and make a mark of the borders of the redness and sort of follow that. And as time goes on, it's either going to get bigger if the infection's getting worse, or it'll get smaller and go away as the infection gets better.
Right.
So these are things that are important for you to know, and you should be able, if you're going to be the medic, be able to recognize a wound infection. I think everybody should anyhow. Yep. Now, if you had antibiotics, you could treat an obviously dirty wound at an early stage, or infection at an early stage, and improve the chances that the healing will occur rapidly and occur completely.
Yep.
Now, there are a lot of rugged folk out there that are likely to tough it out and say, well, I can get over this. And indeed, sometimes they will. But doing that just really gives time for the infection to get worse and eventually spread to your blood. If that happens, the end result is not good.
So don't ignore the signs of infection. Right. Just because you're a tough person.
That's right.
The infection doesn't care how tough you are.
Bottom line, if you have access to some antibiotics, that problem can be nipped in the bud before a tragic outcome occurs. Right. Recommending alternative sources of antibiotics is pretty contrary to standard medical advice, and so it's only appropriate when help is not on the way. I've said that 4 times already, and I'm going to...
And my disclaimer, and I said it too.
A million times. Now, you can get small quantities of antibiotics if you're willing to tell the doctor that you're going out of the country and would like to avoid things like traveler's diarrhea. You might not know, by the way, that some forms of traveler's diarrhea are actually treated or prevented with something called bismuth subsalicate.
Ooh, Pepto-Bismol. Here, let me hold that.
Pepto-Bismol.
So you can talk.
Vanna White. And Pepto-Bismol indeed has been used to prevent traveler's diarrhea. If you take the equivalent of 2 tablets 4 times a day, and while you're on a trip to a at-risk country for that kind of thing, it can decrease the incidence by up to 60%. So it might be it sounds too good to be true, and in a sense it is, because people who take that amount of Pepto-Bismol for any significant length of time probably get pretty bad constipation, to be honest. But indeed, that's something
that would make sense.
That's another over-the-counter option to prevent that particular problem. I should say also that you can get Tamiflu, or maybe the newer one-day influenza drug, Xofluza. Now, these are antivirals that work only against influenza, but at the beginning of every flu season, if you ask your doctor for a prescription for you and members of your family, then usually they really don't have too much trouble with it. And the reason why is because you have to use that stuff within 48 hours of getting the first symptom.
Real quick.
Not everybody can get in to see their doctor within 48 hours.
Right. And
so for that reason, most doctors really aren't that troubled by giving you a prescription for that. The only problem is that anybody who thinks it's going to cure COVID-19, that is a mistake.
Yeah.
It doesn't do a darn thing for that. So that's something that's important. And of course, also, if we go back to antibiotics, remember antibiotics only work against bacteria. They don't work against viruses at all.
Right.
So a lot of these medicines are very, very specialized. Antibiotics are bacteria only. Tamiflu and Xofluza only effective against the influenza virus.
Specifically.
That's right. And there are other medicines like acyclovir, which is specific for herpes virus, things like that. There are antivirals that are specific for individual viruses. Right. That's right. Your family doctor might be good for 1 or 2 courses of therapy, but you could need some kind of long-term alternative if you're going to be the survivor caregiver. I mean, if you're going to have enough antibiotics to prevent a family or survival group that's been knocked off the grid in the aftermath of a disaster, some deaths might be unavoidable. I mean, you might get exposed to radiation and you'll be burnt toast. But
well, it depends on how close you are, though, honey. Not everyone will be burnt toast.
That's right. Not everyone. We'll be
doing
a show. We'll be doing a show on that.
Not downwind.
And we also have articles on that at doomandbloom.net, so you can check that out absolutely free.
One of our 4,000 topics that we're going to be talking about.
So anyhow, we found a viable option in these fish and avian antibiotics.
Yep.
And the reason why we came upon it is that we're sort of a weird combination, that we're actively licensed physicians and nurse practitioners, but we're also
fish hobbyists.
Fish hobbyists, as a matter of fact.
Yes.
We're pretty good at it, too, as a matter of fact. I don't know if you
well,
can see that. You think you can see those over there? Those are some of our ribbons.
Oh, that's in there.
That's just some of our ribbons from...
Just a few of them.
from fish shows. But anyhow, for years we used aquatic medicines on sick fish, fin rot and things like that. Those are bacterial diseases in fish. Birds can get bacterial infections. Actually, you can get chlamydia, believe it or not. And we have a parrot at home. So we decided to, since we had these medicines around and got interested in...
straightening your shirt.
Thank you so much. Got interested in survival. We were looking at ways that we possibly could save some lives. And so we took a look at one of these medicines. This particular one was called Fish Mox. And it was put together by Thomas Labs, distributed by Thomas Labs. And the thing that we saw here is that there was exactly one ingredient in it. And the ingredient was amoxicillin, 500 milligrams. 500 milligrams, interestingly enough, is the exact dosage you would give an adult human. And so that struck us as a little bit funny. These things are for fish, but a number of them seem to only come in human dosages. We looked at it, and nothing else on the bottle that made your scales shiny, in terms of ingredients.
One ingredient.
The question is why should a guppy require the same dose of amoxicillin that a human adult would? The theory is that you put this in the water and, it has to be a formula. Dispersed in the water.
Right.
But the problem
Dilution.
is, a decade ago, they didn't give you really instructions on how much to put in a fish bowl and how much to put in a 200-gallon aquarium.
Right.
Now that's changed. Now those instructions are very, very clear now.
Yes.
But in the past, they weren't. It was actually sort of hard to find it. So we did the acid test, and the acid test for this was to take this Fish Mox Forte, and we compared it to human amoxicillin 500 milligrams. And so the Fish Mox Forte was a red and pink capsule with the numbers and letters WC731 on it. And human amoxicillin, made by Deva Pharmaceuticals, was a red and pink capsule with the numbers and letters WC731 on it.
Same thing. Same pill.
Logically, it made sense. They were essentially identical.
Not essentially.
They are identical.
They are identical.
Okay.
And the reason we know this is because the FDA is very specific on colors and numbers for capsules and any pills that you take, because if you find pills and you don't know what it is or where it came from, you have to be able to identify this, especially if someone had an overdose, or let's say you went to grandma's house and she's just got a bowl of pills. Or if somebody has some reaction and maybe the bottle is gone, they need to know what was taken. So the FDA assigns, or probably the manufacturer applies to have certain colors and certain letters and markings. These are specific to one drug. So what you just mentioned, the WC731 with the red and pink capsule, is only made by Deva Pharmaceuticals. That's it. Nobody else is allowed to have those colors and those letters and numbers on them. So each drug by each company is assigned colors and letters and numbers. That's what they are allowed to use. If they change their formula or some other company makes them, they have to change their colors and numbers, because the FDA needs to know where and who manufactured and what it is. And that's the identification. So when you open any of these, you will be able to go on drugs.com, rxlist.com, pills.com. Is that one of my
pills.com? I think
pills.com.
The physician's desk reference is in digital form,
right?
Also, so a lot of different ones. They'll
so
show you pictures of it.
You can prove this to yourself.
Yes. The reason why we know this is because readers of ours that work in the pharmacy fields and veterinary fields actually confirmed it for us.
They know this.
So
it's just a fact.
Now, that's not to imply that all veterinary antibiotics meet the criteria.
Right.
Okay. Many cat, dog, livestock antibiotics, they contain additives that might cause ill effects on a human being. So you want to look only for those veterinary drugs that
single ingredient.
Oh, right, single ingredient, only come in human dosages.
Right.
Only come in human dosages.
And we're only talking about antibiotics right now. There's
That's right.
$1 million